بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. This is a lecture on Pharmaceutics 2, code PT404. I am Professor Dr. Mona Abulanin. Hi. And this is my office hours. This is my office. And this is my email. And of course, you can send me an email containing your questions anytime. These are reference and recommended textbooks of this course. And this is the time to start our lecture. Let's begin. Last lectures of semi-solid dosage forms that this group of dosage forms is composed of four main types: creams, ointments, gels, and pastes. And we already finished discussing creams and ointments, and now we will start discussing gels. In gels, we will discuss definition of gels, types, uses, advantages of gels. Then we will discuss formulation of gels and preparation of gels. First, definition of gel. As usual, dermatological gels are semi-solid dosage forms intended for topical use, as all the four solid forms we will study under the title semi-solids. So, dermatological gels are semi-solid dosage forms intended for topical use. So, what is the characteristic composition of gels? Gels are composed of a single liquid phase. Single liquid phase containing the drug. Liquid containing the drug, it is solution. No, it's not a solution. This solution of the drug made semi-solid by the addition of a gelling agent. So, the characteristic composition of gels is that they are composed of single liquid phase. The drug is dissolved in this liquid phase, and the solution of the drug is made semi-solid by the addition of a polymer called gelling agent. Let us compare composition of gels with that of creams and ointments. Compared to creams, creams are formed of two immiscible phases, not a single liquid phase. For ointments, ointments containing water are also emulsions, so they are formed also of two immiscible phases. Ointments that do not contain water are formed of a single phase, but this phase is not liquid, it's a fat. Okay? But here in gels, they are composed of a single liquid phase, and this liquid phase is made semi-solid by the addition of a gelling agent. What is gelling agent? If you have this liquid, then you add the gelling agent, which is a polymer, to this liquid. The gelling agent will arrange itself in the liquid, and intermolecular bonds will be formed, so the gelling agent forms structural network, and this network increases the viscosity of the liquid and converts it to semi-solid, which is called gel. There is gelling agent, a polymer, when dissolved in the liquid, gives structural network and increase in the viscosity of the liquid to form the gel. It's nice to differentiate between gel and jelly. Gel is used to express a semi-solid dosage form intended for topical use and composed mainly of a single liquid phase with a gelling agent. But jelly is a dessert. So what about types of gels? As we know, gels are composed of gelling agent dispersed in the dispersing liquid. According to the solubility of gelling agent in the dispersing liquid, gels are classified into two classes. When the gelling agent is insoluble in the dispersing liquid, you will get two-phase gel system, and its logic. The gelling agent is insoluble in the dispersing liquid, so when they are mixed together, they still two phases. And when the gelling agent is soluble in the dispersing liquid, you will get another type of gels, which is one-phase gel system. They are called one-phase because the gelling agent is soluble in dispersing liquid, and they form one phase, which is a solution of the gelling agent in the dispersing liquid. So types of gels. Gels are classified into two main classes: two-phase gel systems and one-phase gel system according to the solubility of the gelling agent in the dispersing liquid. Let's discuss both briefly. Two-phase gel systems, as we said, they are gels in which gelling agent is insoluble in the dispersing medium. Examples of two-phase gel systems are aluminum hydroxide gel and bentonite gel, and I'm sure you saw aluminum hydroxide in the chemistry lab. The precipitate of aluminum hydroxide is a gelatinous precipitate, and this gel formed from aluminum hydroxide is two-phase because aluminum hydroxide is insoluble in water. So aluminum hydroxide gel and bentonite gel are examples of two-phase gel system. Two-phase gel system are turbid because the gelling agent is insoluble in the dispersing liquid, and they have thixotropic flow behavior. What is thixotropic flow behavior? I will remind you. Thixotropic flow is a kind of shear thinning flow. This means that when applying a force to our system, which is a semi-solid system, it is a gel system with high viscosity. When you apply a shear to this system, the viscosity of the system decreases. This is shear thinning. There are different types of shear thinning flow. In thixotropic shear thinning flow, when you stop applying shear, by time you will find the viscosity of your system increases by time after stopping shearing. Okay, this is what about two-phase gel system. One-phase gel system, on the other hand, as we said, in one-phase gel systems, the gelling agent is soluble in the dispersing medium. For example, hydrophilic polymers. And of course, because they are hydrophilic, they are soluble in the dispersing medium, which is most likely to be water. And because they are polymers, when they are soluble in water, when they are dissolved in water, they increase its viscosity because they can form structural network between polymer molecules. Of course, one-phase gel systems are clear. They show pseudoplastic flow, and pseudoplastic flow is another type of shear thinning flow. In pseudoplastic flow, when shear is applied to our gel system with high viscosity, the viscosity of the system will decrease. And when shear is further applied and increase, when you increase the force applied on the gel, the viscosity increases again and gel formation happens again. This type of shear thinning flow is called pseudoplastic flow. In pseudoplastic flow, first shear thinning occurs, and when you increase the shear, increase the force applied to the system, shear thickening or increase in viscosity of the system takes place again. These are the differences between two-phase and one-phase gel systems. Types of gels. When we compared one-phase and two-phase gel systems, as you saw, two-phase gel system is not preferred. They are not clear, and the appearance is not so good. So pharmaceutical gels are of one-phase system. So from now on, we will consider only one-phase gel systems because they are the type of gels that are used pharmaceutically. In one-phase gel system, there is subdivision of this cell system. They are classified according to either the dispersing liquid or the cross-linking forces. There are two systems to classify one-phase gels. Either classify them according to the type of the dispersing liquid or according to the type of the cross-linking forces formed between polymer molecules to give structural network and increase the viscosity of the system. According to the dispersing liquid may be aqueous, may be water, and in this case you will get what's called hydrogels. Hydrogels are gels with water as the dispersing liquid. Dispersing liquid may be non-aqueous, it may be an organic solvent, and in this case we will get organogels. So the difference between hydrogels and organogels is in the nature of the dispersing liquid. In hydrogels, the dispersing liquid is water. In organogels, the dispersing liquid is organic solvents. One-phase gel system can be also classified according to the cross-linking forces between polymer molecules, and here they are classified into two types. This is the polymer molecules. When they are dissolved in the dispersing liquid, they suffer cross-linking. The cross-linking takes place between these molecules, forming a structural network, and this network increases the viscosity of the gel. Cross-linking forces may be covalent bonds or van der Waals or hydrogen bonds. Covalent bonds are strong bonds, and van der Waals and hydrogen bonds are weak bonds. So, one-phase gel systems can be classified according to the cross-linking forces between polymer molecules into those gels that have strong bonds between molecules of polymer, and these strong bonds are covalent bonds, and the other type is the gel containing weak bonds between polymer molecules. These weak bonds are represented by van der Waals bonds or hydrogen bonds. In the type of gels that contain strong covalent bonds between molecules, as you see, these are the molecules of the polymers. There is a covalent bond between them. Actually, this covalent bond is not formed directly between the two molecules of the polymers. They need cross-linker to form this strong covalent bond. What is a cross-linker? It's a chemical substance that can bind to one polymer molecule from one side and to another polymer molecule from the other side. So it links both molecules together with covalent bond. This covalent bond is strong, so the formed gel is irreversible and with high flexibility. This type of gels are used for wound dressing and soft contact lenses. And soft contact lenses is a very good example of this type of gels. In soft contact lenses, molecules of polymers are linked together with a strong bond, which are covalent bond, so the gelling process is irreversible. If you have a soft contact lens and apply a shear on it, it will never be a liquid because here gelation is irreversible due to the formation of the strong covalent bonds. This type of gels is called type 1 gels. So type 1 gels is a type of one-phase gel system where the molecules of the polymer are linked together with strong covalent bonds. The other type of one-phase system is those linked together with van der Waals and hydrogen bonds, which are weak bonds. These are the polymer molecules. They can be linked together directly without cross-link via van der Waals or hydrogen bonds and no need for cross-linker. In this case, this bond is weak bonds and the gelation process is reversible. If you apply a shear on this gel, its viscosity decreases. Then this is called type 2 gels. Type 2 gels is a type of one-phase gelling system. In this type, the bonds between the polymer molecules is weak, formed from van der Waals or hydrogen bonds with no cross-linkers, and the gel is reversible. Because the gel is reversible, this is the preferred type to be used in pharmaceutical preparation. So, concerning pharmaceutical gels, we prefer one-phase system over two-phase one. استخدم one-phase system مش two-phase system. And within the types of gels in one-phase systems, which are type 1 and type 2, I prefer type 2 gels. So from now on, when I say gel, I mean type 2 of the one-phase gel system. احنا قلنا ان الجلز بتتقسم حسب السوليبيليتي بتاعت الجيلينج ايجنت في الديسبرسنج ليكويد الى two phase gels and one phase gels. وقلنا two phase gels دي مش كويسين، ما ينفعوش للفارماسيوتيكال برودكتس، فاحنا هناخد ال one phase gel. الون فيز جيلز دول ليهم two types. type 1 اللي فيهم strong bonds between polymer molecules وtype 2 اللي ليهم weak bonds between polymer molecules. وقلنا ان من التو types دول احنا يناسبنا type 2. عشان كده من دلوقتي فصاعدا لما اقول جل I mean pharmaceutical gel of type 2 one phase gel system. Advantages of gels, and of course I mean type 2 of one phase gel systems. They are of single liquid phase, so no separation is expected to take place, and this gives stability to this dosage form, physical stability. These dosage forms are physically stable. No phase separation is expected simply because these dosage forms this dosage form is composed of only single liquid phase. They contain high water content, and as we said before, high water content makes the dosage form elegant and can be applied to hairy parts because it's easily removed, with high release rate, with high speed, not amount, high speed of drug release, and it gives cooling sensation. Why do gels give cooling sensation? Due to the high water content. So when this water on application of the gel, this water will vaporize, giving cooling sensation of the skin. لما بتتبخر المية دي بعد ما نعمل application للجل بتدي إحساس بالبرودة. They are suitable for water-soluble drugs. Another advantage of gels is that they may contain co-solvents or other solvents than water, so you can prepare wide variety of gels, wide variety of dispersing liquid, and it makes it suitable for wide variety of drugs. Uses of pharmaceutical gels. Pharmaceutical gels are used in different uses according to their viscosity. Slightly viscous gels are used to replace body secretions. وأكثر مثال هو artificial tears. ناس اللي عندها excessively dry eyes, they may use artificial tears to hydrate their eyes. Artificial tears are example of slightly viscous gels. More viscous gels are used to lubricate tools, and we said before that lubrication is to decrease friction. For example, the sonar device, the doctor needs to move this device on the skin of the patient, so he needs to decrease friction, so he applies a more viscous gel. Sufficiently viscous gels are used for dermatologicals. For example, they may be used for skin lubrication or for anesthetic drugs, أدوية مخدرة اللي هو المخدر الموضعي, or for antiseptic drugs, دواء مطهر برضه موضعي على الجلد. These are definition, advantages, uses, and types of gels. Let's now begin discussing formulation of gels. To know how to formulate a gel, keep in mind that this dosage form is formed of a gelling agent dispersed in a vehicle or dissolved in a vehicle, and of course some additives are needed. So to know how to formulate a gel, you have to know how to choose the gelling agent, how to choose the vehicle of the gel, and what additives should you add to your gel. First, how to choose the gelling agent. To know how to choose the gelling agent, you will need to know properties of suitable gelling agent, which is, of course, a type 2 polymers, different type 2 polymers, and factors affecting gelation of type 2 polymers. What are we always talking about type 2 polymers? Because as we said before, this is the suitable type for pharmaceutical preparation. So we have to discuss properties of suitable type 2 polymers and different types of type 2 polymers and factors affecting gelation of these polymers. First, properties of suitable type 2 polymers. They should be biocompatible. They should give no harmful effect to the skin. They should be with well-defined molecular weight and viscosity. First, notice that molecular weight of these polymers affect their viscosity. So when you purchase a type 2 polymer, you have to know its molecular weight or viscosity. This information should be well defined and should be mentioned on the package of the polymer. They should be compatible with the drug, of course, and they should be soluble, but gels under certain conditions. They should be soluble because we are talking about type 2 gels, and they should increase in viscosity of their solution under certain conditions because we are talking about gels, not solutions. Finally, they should retain its gel form on the skin. These are properties of suitable polymers used as gelling agents. Second, we will discuss different type 2 polymers. Type 2 polymers are classified according to their origin into those of natural origin, or we call them polysaccharides. Example, tragacanth, pectin, gelatin, alginates, and carrageenan. Type 2 polymers may also be of semi-synthetic origin, and we call them cellulose derivatives. For example, methyl cellulose, hydroxypropyl methyl cellulose, carboxymethyl cellulose, and sodium carboxymethyl cellulose. These are cellulose derivatives, and they are semi-synthetic type 2 polymers. Finally, type 2 polymers may be of synthetic origin, and we call them acrylic polymers, for example, polyacrylic acid. Let's briefly discuss each type of these polymers. We will first discuss tragacanth, and as we said, tragacanth is a natural polymer. Tragacanth is found in nature, and it is extracted from shrub of species Astragalus. When extracted, it is marketed in the form of powder. Disadvantages of tragacanth as gelling agent are it is of varied unspecified viscosity. Each time you buy tragacanth to form it in gel formation, you find it of different viscosity, and this viscosity is not found on the label of the package. Tragacanth is of varied unspecified viscosity. During preparation, tragacanth is incompatible with many drugs because it loses viscosity outside pH range 4.5 to 7. So if the pH required for the drug solubility is outside this range, and you use a buffer to adjust the pH to another pH outside this range in order to increase drug solubility, for example, in pH 7.5, for example, you find tragacanth loses its viscosity, and it is a disadvantage. Also, a disadvantage of tragacanth during preparation that it needs dispersing agent. You cannot directly dissolve tragacanth in water. Tragacanth is soluble in water, but unfortunately, it cannot be wetted by water. And to dissolve in water, it should be wetted. How can you make tragacanth wetted with water by using a dispersing agent? Need of dispersing agent makes preparation of tragacanth gel slight difficult. After application, water evaporates from tragacanth gels, result in flaked film. And on storage, tragacanth is susceptible for microbial growth, of course, because it is of natural origin. These are disadvantages of tragacanth. Varied unspecified viscosity، ملوش viscosity محددة، كل باتش تشتريها تلاقي ليها viscosity شكل، ويا ريتهم بيكتبوا الفيسكوستي دي على العبوة. لا، مش بس varied، لا كمان unspecified، مش مكتوبة على العبوة. أثناء البريباريشن لو محتاج تحضر الدراج بتاعك في pH range outside 4.5 ل 7 pH، هتلاقي التراجيكنس على طول يلوز الفيسكوستي بتاعته ويتحول إلى ليكويد مش جل. التراجيكنس بيدوب في المية، بس عشان يدوب لازم الأول يتبل بالمية، يحصل له ويتنج. التراجيكنس بيدوب كويس لكن الويتنج بتاعه ضعيف. عشان أعمل له ويتنج بحتاج dispersing agent زي ما هنشوف دلوقتي. بحتاج dispersing agent عشان أقدر أعمل له ويتنج فيدوب في المية. لو حضرت tragacanth جل وعملت له application على السكين، بعد شوية water evaporates leaving flaked film، يعني فيلم عبارة عن حاجة زي قشور السمكة كده. on storage tragacanth طبعا بيبقى susceptible for microbial growth لأنه of natural origin. What is dispersing agent? Let's explain it more clearly. When you have the gelling agent, yes, it is soluble in the dispersing liquid, but they cannot be wetted with the dispersing liquid. So as long as you stir the gelling agent with the dispersing liquid, it is not wetted and it accumulates and goes up to the surface of the liquid. So how can you make this gelling agent wetted so it can be dissolved in the dispersing liquid? Use what we call a dispersing agent. Dispersing agent is another liquid than the dispersing liquid, but this dispersing agent is a good solvent for the gelling agent and it can wet the gelling agent. So first, mix the gelling agent with the dispersing agent, dissolve it in the dispersing agent, and then add this solvent to the dispersing liquid. So the gelling agent is good wetted now with the dispersing liquid due to the presence of the dispersing agent, and it can be soluble in the dispersing liquid, giving us the gel. A famous example of dispersing agents is propylene glycol. Also, glycerin may be used as dispersing agent in gel preparation. Number 2, pectin. Pectin is also of natural origin. It can be obtained from citrus fruits and pomegranate من الموالح والرمان. Pectin has its disadvantages. During preparation, it needs a dispersing agent, and as we said, this adds more steps to the preparation. And on storage, it is susceptible for microbial growth because it is of natural origin. Then we will discuss gelatin. It's also of natural origin. In fact, gelatin is obtained from the bones of cows and pigs. It is marketed as slightly brown, sandy powder of sand texture, زي الرمل كده. Gelatin is insoluble in cold water. To make a gelatin gel, you have to dissolve gelatin in hot water or in warm water, then in suitable concentration. When gelatin solution is cooled, it gives a gel. To prepare gelatin solution, you have first soak gelatin in some water for 15 minutes. Then apply this, warm this soaked gelatin and add the other amount of water. And this is very tedious method of preparation that makes gelatin no more used as a type 2 polymer. Example of type 2 polymer gels prepared using gelatin is what we call Annas paste. جيلاتين بيدوب في المية الدافية، بس عشان يدوب في المية الدافية لازم تعمل له سوكينج، تنقعه الأول في شوية مية ربع ساعة وبعدين ترفعه على النار هتلاقيه داب في المية الدافية. لو الكونسنتريشن بتاعك مناسب on cooling هتلاقي الجيلاتين حصل له gelling. Preparation of gelatin gel is very difficult, so it is no more used. طبعا in addition in that it is susceptible for microbial growth. So disadvantages of gelatin as type 2 polymers are its preparation is difficult and on storage it is susceptible for microbial growth. Next, type 2 polymer is algenic acid and its salts. Please note that algenic acid is of natural origin. We can take it from brown algae and it is marketed as brownie powder as you see. For salts of algenic acid, sodium and potassium salts are soluble and they form gels, while calcium salt is of no gelling properties because simply it is insoluble. So if you need to use salt of algenic acid as a gelling agent, use sodium or potassium salt and never use calcium salt because calcium salt is insoluble and it is of no gelling properties. Advantages of algenic acid and its derivatives. They are available in different viscosity and their viscosity is specified. It's standardized and specified on the package. You can find for sodium alginate, for example, you may purchase low viscosity sodium alginate with the viscosity written on the package, medium viscosity sodium alginate, or high viscosity medium alginate, again with the viscosity written on the package. So It is available in different viscosity, and this viscosity is standardized and written on the label. This is an advantage of algenic acid and its derivatives. Disadvantages: they need dispersing agent, and زي ما قلنا, this makes their preparation somewhat difficult, and they are incompatible with basic drugs. This is a package of sodium alginate. Let's take a closer look on the label. بصوا الليبل مكتوب عليه ايه؟ sodium alginate, low viscosity, where viscosity is a standardized viscosity of 2% solution at 25 degrees is 250 centipoise. Standardized viscosity, مش بس it's offload viscosity, no. Viscosity of 2% solution. If you prepare 2% solution at 25 degrees centigrade and measure the viscosity, you will find it 250 centipoise. And as we said, this is a very important advantage of algenic acid and its salts. Now we come to carrageenan. Also, carrageenan is of natural origin. It is obtained from seaweeds, and its form is white powder. Carrageenan is a polysaccharide derived from seaweeds. There are 3 derivatives of carrageenan. Take care. This is very important. When you purchase carrageenan, take care what derivative you are purchasing. There are 3 derivatives of carrageenan: lambda carrageenan, iota carrageenan, and kappa carrageenan. They are different in their gelling properties. Lambda carrageenan has no gelling properties, so if you need to buy carrageenan to use it in gel preparation, never buy lambda carrageenan. Iota carrageenan is of moderate gelling properties, and kappa carrageenan is of excellent gelling properties. This means that if you have iota carrageenan and kappa carrageenan, and you prepare a gel, 2 gels, one of iota carrageenan and one of kappa carrageenan, so that the polymer concentration in the 2 gels is equal, say 2% in both gels. Which gel will be of higher viscosity? Of course, kappa carrageenan, because its gelling properties is excellent. This is the 2 packages of kappa carrageenan on the left and iota carrageenan on the right. Let's stop here. By now, you are supposed to be able to define gels, differentiate between creams, ointments, and gels according to the main characteristic of each dosage form, enumerate different uses and advantages of gels, differentiate between different types of gel, and define the one suitable for pharmaceutical use, which is type 2 one-phase gel system. You can also design a gel. Next, type 2 polymer is algenic acid and its salts.